Okay, guys, good afternoon. Hey, we're gonna start and finish today the respiratory system. And as I said earlier, I will record and post the lymphatic system video so you guys can watch. And on Monday, I will post the exam and you will have time till Saturday to finish this time. Okay. So in the respiratory system, before I start, I have sent email to you guys today. So if you are interested in doing uh, supplemental instruction leader next fall semester, so for that you have to fill up the form, contact the Student Success Center, or you can send me email and I will forward your name. SI leaders are the leaders which provide instruction outside the classroom, like a tutoring, but it is a group tutoring and it is planned, organized tutoring, group discussion that helps a student to learn the material instructor teach in the classroom. And you get the training for that. You are paid during the training. Then you do 20 hours per week. I think you have to take uh, minimum 6 units of class to be the part of SI leadership, and they will train you. So, and in the class, you have at least be in the class in that subject to do tutoring. Okay. So look at the email and then respond if you are interested, and I will forward your name. So the respiratory system today, I will be going over the respiratory system organs and their structure and their basic function. And when we talk about the organs, I will go over the organs in the order from nose, from proximal to distal part. In the respiratory system, like you have GI tract, we have respiratory tract from nose to lungs. And this tract can be divided into upper tract and lower tract, as well as the respiratory zone and conducting zone. So we'll talk about what is conducting zone, what is the respiratory zone, which part of the respiratory tract is upper and which part is lower. Then we will talk about structure and function of all other parts of the respiratory system, like nose, pharynx, larynx, lungs, and pleura. And we will talk about their function. Okay. So starting with a clinical case, a 30-year-old male presents with 2 months history of frontal headache, chronic congestion, nasal drainage, nocturnal coughing, which followed after an episode of flu. Explain the disease process and its complication. So here, it is a young male patient, history of 2 months of headache, particularly frontal headache, means in the front side of your head. Chronic congestion, congestion means nasal congestion, blockage of nose, and then discharge from nose. It is anterior drainage, means when it comes through the nose, and posterior drainage when it gets into your throat. And then cough in the nighttime, nocturnal coughing. And this all happens after you had flu. So you see, first there is viral infection and then another infection follows. Most possibly this is bacterial infection, and this is the infection in the sinus of the head. So we're going to see what is infection of the sinus called, that is sinusitis, and how it happens. Okay. So basic function of the respiratory system is to supply body with oxygen. It takes oxygen and sends to your cells. It sends oxygen to your blood, and then blood takes it to the tissue. At the same time, blood brings carbon dioxide after using oxygen and disposes into your alveoli, which respiratory tract exhale it outside. And during the performing of respiratory function, there are 4 processes which involve respiration. And these 4 terminology is very important because you will be asked what are they. So let's breathe in and breathe out at least 2 times. When we take air in, that is called inspiration. When we breathe out, that is called expiration. And this taking in and out of air during the breathing is called pulmonary ventilation. Means you are ventilating, passing the air in and out in the respiratory system from nose to the lungs. Everybody got it? What is pulmonary ventilation? Pulmonary ventilation is air moving from your nose to the lungs. So here we have a model here, you can see. So you inhale air through the trachea, then it comes to your lungs. That is pulmonary ventilation. Now what happens after that? When air enters your lungs, from the lungs, where oxygen is in high concentration, diffuse into your blood. Okay? And from your blood, carbon dioxide diffuse into the lungs. And that process is called external respiration. A student usually get confused external respiration with the ventilation. Okay? Breathing in and out of the respiratory system is not external respiration, that is ventilation. Respiration is always exchange of gas. Movement of gas is not respiration. Movement of gas is ventilation. So external respiration is exchange of gases at the lungs or in the alveoli. Then what happens? Oxygen diffuse into your blood and carbon dioxide come into your alveoli. So where does oxygen then bind with? With which component?
Hemoglobin.
Hemoglobin. Oxygen bind with hemoglobin or dissolve in water part of your plasma and then carried. And that transport of gases in the red blood cell and in the plasma is called transport of respiratory gases. So from the tissue, your blood is carrying carbon dioxide, and to the tissue, your blood is carrying oxygen. Then that gas reaches from capillaries to the cells. And let's see, from the capillaries, it gets into extracellular space and interstitial space. From there, it enters through the plasma membrane of any cell, like brain cell, muscle cell, fat cell, liver cell, any cell. And inside the cell, there is mitochondria where it is used. So where is gas exchange taking place here again? Between the capillaries and the cells. From the capillaries to the cells, from the cells to the capillaries. So from the capillary, you are taking oxygen to the cells, and from the cell, carbon dioxide is coming to the capillaries. And that exchange of gas is called internal respiration. So internal respiration is exchange of gas at the tissue or cell level. Now inside the cell, oxygen is used to make ATP, where cell use oxygen in mitochondria and make ATP. That using oxygen and producing carbon dioxide inside the cell is called cellular respiration. So 4 processes involved in respiration is pulmonary ventilation, external respiration, transport of respiratory gases, internal respiration, and cellular respiration. Respiratory organs are nose, nasal cavity, paranasal sinuses, pharynx, larynx, trachea, bronchi, smaller branches and of the bronchi and bronchioles, and then lung, and the smallest unit of the lung is the alveoli, plural, and singular is alveolus. So let's see that. You start from the nostril and nasal cavity, then you have nasopharynx, oropharynx, laryngopharynx, and then trachea. This one. Then trachea divide into right and left primary bronchus. And this point where it branches is called carina of trachea. Then trachea further branches off, becomes, this primary bronchus becomes secondary, tertiary, segmental, terminal, respiratory, and then alveolar duct, alveoli. So from here up to here, it is like more than 60,000 times branching. And then ultimately alveoli. So they are so small, tiny branching of these, the primary bronchus. They need to support connective tissue. That's why there is a lot of connective tissue inside it and hold those branchings. And that is together called lungs. Lungs is surrounded by double layer of membrane called pleura. We have not written here, but this blue lining is pleura. It has double membrane. Pleura is attached to the diaphragm. You see, diaphragm is the major muscles of respiratory tract. So this is called these are the organs of respiratory tract. Okay. So now you can see here is, if you can you see this model?
Yes. Yes.
So this is the larynx. Larynx is made up of 9 cartilages. And if you open inside, you can see here, this is the vocal fold inside here, which produce sound. And then in posterior, you can see epiglottis. So the trachea here. Trachea is a tube made up of hyaline cartilage. There is 20 cartilage. And posteriorly, it is not complete. This is called, so each cartilage breathes with trachealis muscle. That's how your trachea is expanding, relaxing, expanding when you're taking air in. Okay. And when behind your trachea here, this is the trachea. So if you see behind here, you have esophagus. So when you are eating, esophagus gives pressure to trachealis muscle. And that's why esophagus has room to expand and relax during eating. So trachea now divide at the carina, becomes right bronchus and the left primary bronchus. And then it further divides, becomes secondary bronchus. Before it becomes secondary, which side you think is shorter and which side is longer primary bronchus? Look at the model.
Right is shorter.
Right is shorter. You see, right is shorter, and its diameter is also slightly bigger. In this model, it does not show, but right is shorter and it has larger diameter. And it is more vertical. Left is more horizontal compared to right. So let's say by accident, if a kid or you swallow peanut, and instead of peanut going into your esophagus, if it enters your larynx and then in trachea, which side you think mostly the peanut will lodge in, left or right?
Right.
Right.
Right, because it is horizontal, wider, and shorter. That's why when there is foreign body in the respiratory tract, and when we go to emergency room, the doctors, first they put bronchoscope in your right side of the primary bronchus, so they can see the foreign object and take out immediately, 90% time. Only when you're lying down and then you swallow and then you inhale, then it may be in the left side, or unconscious patient, then in the left side. Otherwise, it is always in the right side, and you know the region. Okay. So this is secondary, primary, secondary, then tertiary. Okay. The upper respiratory tract is any part above the larynx. So larynx and all the parts here is upper respiratory tract. And trachea and below every structure is lower respiratory tract. Now, another way of classification of the tract is conducting zone and respiratory zone. So the zones, area of the respiratory tract which do not exchange gases, we call them conducting zone. And the area which exchange gases, we call them respiratory zone. So if you see here, trachea, nose, pharynx, larynx, nasopharynx, everything up to the terminal bronchioles are conducting zone. And after the respiratory terminal bronchioles, it becomes respiratory bronchioles. And then alveolar duct, alveolar sac, and a small bump you see like grips, those are alveoli or singular alveolus. These all structures are respiratory zone because these area can exchange gases. Higher you are, less gas you will exchange. Lower you go, more gas you will exchange. The most efficient area of gas exchange in the lungs are the alveolus. Okay. So in the exam, if I ask which one of the following is not a conducting zone or respiratory zone, you need to identify. Okay. So nose, this is the mid-sagittal section of the nose, and you are looking at somebody's left side of the nose, and you can see the left medial border of the right side of the nose, which is left side of the right nose, and you can see nostril, nasal cavity, and then in the medial side, in nasal cavity, what do you see? There is like turbinates, and then there is cavity. So each turbinates are called concha, and we have done that in the bone. So this is superior, middle, inferior, conchi, and then cavity underneath are called meatus. And these meatus are continuous with they have directly, indirectly communication with the cavities in the bones of the head, and they are called sinus, like frontal sinus, sphenoidal sinus, maxillary sinus. We'll see that later. Okay. So nose provides an airway for respiration. They add some water to the air if air is very dry, and then warms air if air is cold, and makes it to the body temperature, and then it passes down through the pharynx to the larynx and then trachea. Nose has another function. Due to these turbinates, it also helps in resonating chamber for the speech. So if you have like nasal congestion and these conches are all congested and then you talk, you have a nasal voice because your resonation function is gone. Nose has another function, is house olfactory receptor for smell. So if you see roof of the nose here, there is cribriform palate of ethmoid bone where the olfactory nerve passes, and whatever you sniff, you can smell. In the interior part of the nose, this area is called Little's area, L-I-T-T-L-E, Little's area, or we also call it Kisselbach's plexus here. You see, there is a lot of, in the nose, there is a lot of blood vessels. Do you know why? To make cold air warm and cool down the hot air based on blood flow here. So Kisselbach plexus is the area where all these arteries become capillaries and they join with each other. And that's why we call them plexus, vascular plexus. And in this vascular plexus, arteries are like capillaries are very tiny and a lot, and they are covered by just epithelium and mucous membrane. So they are very superficial. That's why if your nose is dry and you are picking your nose, you can take when you pick the nose, you can scrape the dry, the mucus in the nostril, and you can rupture the blood vessel, and then bleeding starts. And that bleeding is called epistaxis. And that happens usually with the nose picking, but if you have high blood pressure, chronic hypertension, or bleeding disorder, these people will get that too. Okay, so that is in the nose you have olfactory mucosa where you smell, and respiratory mucosa, which is pseudostratified ciliated columnar epithelium down below. That is the nose. And then in upper respiratory tract, you can see everywhere there is like in the nose, and then after that you have nasopharynx. In the pharynx, you have opening of the pharyngotympanic tube. This area opens into your middle ear cavity, and posterior to that you have pharyngeal tonsil. These are the lymphatic node, and then behind the node you have another. In the oropharynx you have palatine tonsils, and behind the tongue you have lingual tonsil. So these all tonsils are like guard sitting on the opening of your mouth where they can get exposed to microorganism and fight the infection. Okay. The respiratory mucosa is the pseudostratified ciliated columnar epithelium. So you can see this is pseudostratified respiratory epithelium. It has cilia, it has goblet cell, lighter, which produce mucus, then connective tissue, and then a lot of glands under the submucosa. Okay, and then smooth muscles. So this epithelium also found in the sinus of the head. That's why infection from the respiratory tract easily is spread to the sinus and to the middle ear cavity through this opening of the pharyngotympanic tube. So as I said earlier, paranasal sinuses, this is the diagram you can see. Paranasal sinuses are named after the bones. So these are two frontal bone sinuses each side. So we call them frontal sinus. Then in ethmoid bone, there is ethmoidal air sinus. In the sphenoid sinus. In the maxilla, you have maxillary sinuses both sides, but mandibular bone is highly movable and it does not have any sinus. Okay. This is the mid-sagittal section, parasagittal sections to show the sinuses. So sinuses are air-filled cavity in the bones, and these sinuses basically reduce the perceptive weight of your head and make your head lighter. Pharynx or funnel-shaped passageway, it has three parts we talk about. The pharynx, which is behind the nose, is naso, behind the mouth is oro, and behind the larynx is laryngopharynx. These all pharynx are covered by basically nasopharynx, oropharynx, they are covered by the stratified, and then the respiratory mucosa start from there. These are the tubules, we talked about it, tonsils. Okay, so let's talk about the larynx. Larynx here. You see the laryngeal prominence or Adam's apple in male. This one is Adam's apple. Larynx is made up of 9 cartilages, and those cartilages are, this is thyroid cartilage, this is cricoid cartilage, and then there is other cartilage like corniculate cartilage, here you go, 3 pair. So these are thyroid, and then arytenoid cartilage, corniculate cartilage, and cuneiform cartilage. These small cartilages are here, this area. Okay. These cartilage makes your these cartilages, and then epiglottis. Epiglottis is here. So altogether they are 9. Let me how you count them 9. Thyroid cartilage 1, cricoid cartilage 2, and this is 6. So 6 and 2, 8, and the epiglottis. And then vocal fold and vestibular fold, as I said earlier, here. So if you open it, this is vocal fold and vestibular fold here. See, so which cartilage is this?
Laryngeal prominence.
And here, cricoid cartilage. And other cartilage are smaller inside. And then as you see, there is trachea. Trachea is made up of tracheal cartilage, and there are 20 tracheal cartilage. The trachea from the larynx, now trachea starts, and you see this is cricoid cartilage. Here is thyroid cartilage. Your thyroid gland is just below the thyroid cartilage. You usually think like it is just above the thyroid cartilage. It is not. Here is thyroid gland in your neck. So trachea now descend into your mediastinum. Mediastinum is the space between the two lungs. C-shaped cartilage rings keep airway open. So this is C-shaped cartilage. You see here? See? C-shaped cartilage. C-shaped. Carina marks the trachea divided into 2 primary bronchi and epithelium of the trachea. So inner lining of the trachea will be pseudo-stratified ciliated columnar epithelium. So if I cut here at this level, what are you going to cut? You're going to cut anteriorly trachea, and behind the trachea you have esophagus. So here, anterior part is trachea, and posterior is esophagus. In one section, transverse section, you can see anterior, posterior. So what are the layers of the trachea? The outermost layer of the trachea is adventitia, which is connective tissue. Then this blue layer, thickest layer is called, what is that called?
Mucosa.
Cartilage.
Oh,
Yeah.
oh, okay.
Cartilage. And then there is some mucosa, the yellow layer. And then this maroon squivy lining epithelium is mucous membrane. What kind of mucous membrane is this in trachea?
Pseudostratified columnar ciliated
Ciliated columnar epithelium. And then you see some glands in the mucosa, which is coming from the submucosa. You know, all the glands in the body are the continuation of epithelium. That's why you see it is the gland, but its opening is in the lumen. So we call it exocrine glands. Then posterior part of the hyaline cartilage and trachea is not continuous. So this is bridged by mucosa, submucosa, and posteriorly by trachealis muscle. This trachealis muscle is smooth muscle. And here is the epithelium photomicrograph. Bronchial tree. Bronchial tree extensively branching respiratory passageway. Primary bronchi or main bronchi, largest bronchi, and the right main bronchi wider and shorter than left. We talked about these things. So you see here. Now let's see the lungs. Can you guys see it now?
About half of it.
Half of it only. How about now?
There, yeah.
Okay. So this is the right lung, left lung. How many lobes in the right side? 1, 2, 3. And these are the features. Okay, so in the right side, we have 3 lobes. You can see here. In the left side, we have 2 lobes. And in between the lungs, which structure lives here?
The heart.
The heart. And if we remove the heart, the cavity in between this is called mediastinum. So in the mediastinum, there is heart and there is great vessels. There is trachea. Okay. These are the transverse fissure, and oblique fissures. Okay. And these are all the branching of the lungs. So this is trachea, left primary bronchus, and then it goes to each lobe. So we call them lower or secondary bronchus, and then segmental or tertiary bronchus. Secondary or lower bronchi, 3 on the right, 2 on the left. Tertiary segmental bronchi branch into each lung segment. And then bronchials, they are the little bronchi, less than 1 millimeter of diameter. Terminal bronchials is less than 0.5 millimeter of diameter. So anything which you inhale and want its effect into the bronchials, that inhaler's particle size should be less than 0.5 millimeter of diameter. So check next time when you're inhaling, check the medication bottle or canister and see what is the size of the droplets which dispense every time you take it. Okay, now the structure of the respiratory zones. So respiratory zones start from the terminal bronchials and then respiratory bronchials, you can see. And let's start with the alveoli from the very beginning in the respiratory bronchials. Then you have alveolar sac and alveoli. So if we make a cut section here, you see alveoli. If we make a cut section of this alveoli, let's see if we make a cut section here and remove superior part and then see under the inside the alveoli, you're going to see the structure, histology of the alveoli. Okay, so let's see here now. See, this is respiratory bronchials. Let me tell you here one important thing. So you see here is cartilage, then secondary bronchus cartilage, tertiary cartilage, and as you go down, the amount of hyaline cartilage is reducing, get less and less. Then in lower part, you have only, just a minute. In lower part, you can have students in tomorrow. Okay, so and when it reaches the respiratory zone, then you have almost like in the tertiary bronchials, respiratory bronchials, you see some of the very thin muscles. And when you reach the alveoli, you lost like completely, there is no muscle, there is only 1 cell thick simple squamous epithelium. And around the simple squamous epithelium, there will be tiny, tiny capillaries covering around this. So there is like 1 cell thick simple squamous epithelium, then there is capillaries. That's where they exchange the gas. And I will go over that in detail in coming slides. Okay, so lower you go, you lose cartilage, then you slowly replace all the cartilage with smooth muscle so that they can expand. That's why the bronchodilators, which dilates your bronchials, work only in the smooth muscle area, because autonomic nervous system controls only 3 structures: smooth muscle, glands, and cardiac muscle. Okay, so here you go. This is the alveoli. Oh, this is the sac, alveolar duct, and then you see all alveoli. Alveoli are covered by capillaries. On the surface of alveoli, there is elastic fibers, which helps in elastic expansion and relaxation of the expansion, constriction, expansion, contraction of the alveoli. Okay. So again, if you make a transverse section through the alveoli, then what you're going to see? You're going to see a shack which is covered by network of capillaries. Like when you put a tennis ball in the tennis ball bag in the net, that's how it looks. So let's see here. Here we give a transverse section through several. Here 3, 1 alveoli, 2, 3, 4 alveoli, partial 5, partial 6 alveoli. Okay, so this is one complete alveoli, and we are looking inside the alveoli. Are you guys following me?
Yes.
This is highly magnified structure. So what do you see here inside the alveoli? Let's see the histology of alveoli first. So alveoli is made up of alveolar epithelial cells. You see the hexagonal cells. These cells are type 1 epithelial cells. See, type 1 cell of alveolar wall. So this, you see the nucleus? So these all cells, this one, these all are, and this is the transverse section of that cell. Here is one type 1 alveolar cell. Did you get it? Then if we follow here, you see another cell inside the alveoli that is called macrophage. Then follow again, this is, what kind of cell is this one? Type 1 or macrophage?
Type 1.
Type 1, macrophage, type 1. And then when you reach here, you see rough border cell. This kind of cell is called type 2 or surfactant producing cell, secreting cell. These cells originate from type 1 cells. Let's see the function of these cells. Type 1 cell is the cell which is the part of respiratory membrane where gas exchange takes place. Okay, these all cells are type 1. Type 2 cells are few cells in the alveoli which produce surfactant, a fatty substance like lecithin and phosphatidylcholine that cover this alveolar surface and prevent collapse of the alveoli. Okay. Type 2 cells are, when they die, they regenerate from type 1 cells. So let's see type 1 cell and the capillaries. If you go back, type 1 cells in this alveoli and between these capillaries, gas exchange takes place. So if we give a cut section here, then you have a type 1 cell here. This is the nucleus of type 1 cell. And then you have blood capillaries around the alveolus. So let's see one blood capillaries here. So you have plasma membrane of alveolar cell. Then you have plasma membrane of capillary, which is endothelial cells, because capillary cell wall is also made up of epithelial cells, which is called endothelia. So there is only 2 cell thick membrane, and in between, to attach them, there is whitish area that is called basement membrane. So let's see, what are they? This is capillary, and these 3 structure is called respiratory membrane. So respiratory membrane is, if you magnify here, this area, respiratory membrane is formed by this pinkish purple alveolar epithelium of the alveolar type 1 cell. Then this white area is basement membrane, fused basal lamina of, so this is fused basal lamina, which is the connective tissue matrix. And then the capillary endothelium. That's why this is the thinnest area in the alveoli where gas exchange takes place. So oxygen from the alveoli from here is entering into the first plasma membrane of epithelial cells, then into basal lamina, then into cell wall of the cell membrane of the capillary, and then into the capillary and mix with the plasma as well as bind with the red blood cells. And then carbon dioxide comes this way in the alveoli. So you need to know what are the structure in the respiratory membrane. This is important. See the pores, each alveoli communicate with another alveoli through that pore. Pleura is a double layer sac surrounding each limb, and it has outer layer that is called parietal pleura and visceral layer that is called visceral pleura. The space between these two pleura is called pleural cavity. Okay, this pleural cavity contains some fluid that is called pleural fluid. So pleura help divide the thoracic cavity. Let's see here now. This is the lungs, and then there is pink lining membrane which is attached to the lungs. That is called visceral pleura, like visceral pericardium. And then it flap back, make a small space, and then it attaches to the wall of the thoracic cavity. In doing so, there is a space, potential space, and that is called pleural cavity. You can see the parietal pleura are attached to the diaphragm. This parietal pleura also indirectly attached to the pericardium, both sides. So when you stab somebody in the thoracic cavity, what happens? You can stab through this one. And if its stab is up to the lungs, then air from the lungs can get into this cavity. And building of pressure due to air increase in the pleural cavity is called pneumothorax. Pneumothorax. So pneumothorax is excessive air buildup into the pleural cavity. Normally there is little amount of fluid inside it. Sometimes due to some disease in the lungs, there is fluid buildup in this area, and that is called hydrothorax. Sometimes blood buildup in this, then we call them hemothorax. Sometimes both blood and air buildup there during the knife attack or stabbing, because blood also goes there and air also goes there, and that is called the hemopneumothorax. Those terminology I have written here. Okay. Anatomy of the lungs. So as you know, we earlier talked about it. So lungs has the apex and base, here, base and apex. Hilum of the lungs is the area where structure enter and exit. So what do you think from cardiovascular system? Let me ask you guys. From the cardiovascular system, what you think enters the lungs?
The
What exits the lungs?
air.
Sorry? Go ahead again.
Deoxygenated air.
Yeah, so lungs needs air. So what takes air into the lungs?
Capillaries.
Bronchioles.
Bronchioles. Primary bronchus goes inside. Which artery enters the lungs?
Pulmonary.
Pulmonary artery. And bronchial artery. Pulmonary artery brings deoxygenated blood from your heart. Bronchial artery is the branch of your aorta that brings oxygenated blood not to your heart, to your lungs. And what return back from the lungs? Which artery takes oxygen-rich blood from lungs to the left atrium?
The pulmonary vein.
Pulmonary vein. Good, good. So these things enter and exit at the point, and that point is called hilum of the lungs, both sides. Okay. One important part of the lungs here. You see, the lungs has right superior lobe, right middle lobe, right inferior lobe, and then the fissure between the lobes, horizontal fissure and oblique fissure. In the right side, there is only, left side, there is only 2 lobes, and that is separated by oblique fissure. And those lobes are left superior lobe and left inferior lobe. This area of the lungs is called apex of the lungs. This is the base of the lungs. Have you heard about tuberculosis, TB?
Yes.
TB usually mycobacterium, caused by Mycobacterium tuberculosis, usually start from the apex of the lungs. Okay? Lungs is covered by pleura, then the ribs, then the muscles, then the skin. So if you see ribs, first rib, second, third, fourth, fifth, all the ribs here. The thoracic cavity wall is also supplied by blood vessel. So the thoracic wall, like intercostal muscles between the ribs, between the ribs there is intercostal muscles. And under each rib, the first rib here, second rib here, third rib here. So under each rib, in the intercostal muscles, around the thoracic cavity, you have artery, vein, and nerve. We call it VAN from superior to inferior. Vein, artery, and nerve. Why it is important to know? Let's see somebody has air buildup in pleural cavity. And air is like tensor pneumothorax. Every time patient breathe, air is increasing pressure inside the cavity, and that is compressing the lungs, and then will be lungs failure and patient die. So once, what do you want? You want to release the air from the lungs. To do that, what do you have to do? You have to prick with the needle somewhere. So where do you want to go? You want to go, and you need to find where you need to go. So what is the landmark? Is the ribs. Either you have to go above the ribs, because through the bones you cannot go. So you have to go either above the rib or below the rib. Which point you want to insert your needle?
Above the rib.
Because if you go below the ribs, you're going to prick artery, vein, or nerve, and that will be fatal. So it is important to know the location of the ribs. Okay. That's all. If you have any question, go ahead.
Thank you, Dr. Shaw.